Have you ever spent an extra 20 minutes on a restoration that already looked perfect to everyone else? Or found yourself redoing clinical notes at 10 p.m. because they weren't quite right? Today, we're tackling perfectionism. Perfectionism is the silent struggle affecting many dentists. In the last 2 decades, I've been a mentor, owned a dental group, helped many dentists improve their productivity, their work-life balance, and their clinical restorative skills. I've done over 23 million in treatments myself, and I'm going to let you in on a secret. Perfectionism really isn't what makes you a good clinician. In fact, it might be the very thing holding you back from delivering excellence. In the next 15 minutes, you'll learn exactly why perfectionism is so widespread in dentistry. We'll talk about how it's different from genuine excellence, and most importantly, I will give you a practical, proprietary framework to break free without compromising your standards. If you comment below with clear framework, I will send you our perfectionism assessment tool, a worksheet that helps identify exactly where perfectionism is affecting you. Now let's get straight to the value. What is perfectionism? As a dentist, you may think that perfectionism means having high standards. Well, it isn't. It's the relentless pursuit of flawlessness, coupled with harsh self-criticism when that impossible standard isn't met. For dentists, it often looks like obsessing over minor details with no clinical significance, feeling offended when receiving constructive feedback, avoiding complex cases for fear of imperfection, like that secondary caries that needs a deep margin elevation, spending excessive time on procedures already clinically sound to perfect the shape of the distal marginal ridge of the upper second molar, constantly comparing your work to idealized cases, which I call the showcase syndrome. In a recent survey, over 70% of dental professionals reported symptoms of perfectionism, yet only 15% recognized it as a problem. Most saw it as simply being thorough. Here's where I need to introduce excellence. Clinical excellence is about achieving the best possible outcome within real-world constraints. See, the problem with perfectionism is that it ignores those constraints, demanding flawlessness regardless of context. When you're placing a composite, excellence means proper contouring, good contacts, and appropriate aesthetics, restoring anatomy and function. Perfectionism means spending an extra 30 minutes on shaping pits, offsets, grooves, staining fossas, shaping carabelli cusps while you're running late for your next patient. The most telling sign? Perfectionists rarely feel satisfaction. Even after delivering objectively excellent work, there's always something that could have been better. That's the true cost. Perfectionism steals the joy from your work and replaces it with perpetual anxiety. So why is addressing perfectionism important? Perfectionism is possibly one of the main contributors to burnout. Studies on healthcare professionals, including dentists, found strong correlations with possible causal pathways between perfectionists' tendencies and burnout symptoms. So when you're constantly striving for an impossible standard, you're running a marathon without finish line. I recall a colleague who told me, "I used to think my perfectionism made me a better dentist. Then I realized I was canceling family events just to redo treatment plans. Those treatment plans were already comprehensive, by the way." So beyond burnout, perfectionism creates a cascade of negative effects. Your clinical decision-making suffers when you're terrified of making even the smallest mistake. You become risk-averse, avoiding complex cases that would benefit patients and develop your skills, always looking for the perfect outcome, when a more conservative approach would better serve the patient. Then the team dynamics start to deteriorate. Your dental nurses and colleagues, they start feeling the pressure, creating a tense working environment where collaboration suffers. And there are financial implications. When you spend an extra 20 minutes on every procedure chasing perfection, that's actually time you can't spend with other patients. That's probably one of the dominant reasons why your income is stagnating. Your mental health also pays the price. Perfectionists experience higher rates of anxiety, depression, and imposter syndrome. So you're burnt out, and your income has plateaued because perfectionism is stealing your time, energy, and clinical confidence. I've spent over 1,000 hours distilling my 2 decades of experience mentoring dentists, leading teams of over 100 clinical and management staff, and delivering 23 million in treatments to patients. The result, the 10K to 30K roadmap course, a comprehensive mentorship program specifically designed for dentists who want to break free from perfectionism whilst tripling their income. If you're ready to transform your practice and reclaim your professional satisfaction, click the link in the description below. Perhaps most concerning is how perfectionism can make you a less effective clinician over time. See, when you're paralyzed by fear, your clinical judgment becomes clouded by anxiety rather than guided by evidence. Addressing perfectionism isn't about lowering your standards. It's about recalibrating them to something sustainable and genuinely beneficial. So what's the critical difference between perfectionism and excellence? Perfectionism is rigid, an all or nothing thinking. The perfectionist dentist says, if it's not flawless, it's a failure. Excellence, on the other hand, is flexible. It acknowledges context and constraints. Consider this example. A perfectionist dentist spots a tiny, clinically insignificant void in a composite. Despite running behind schedule, they remove and redo the entire restoration, making their next patient wait 40 minutes. An excellence-focused dentist notices the same void, evaluates its clinical significance, which is none, makes a mental note for improvement next time, and moves on to help their next patient. This is the same clinical situation with vastly different outcomes. Perfectionism asks, is this flawless? Excellence asks, is this the best I could do today, given what I knew, what I had, and who I was treating? If you're finding this distinction helpful, comment excellence over perfection below, and I'll send you our Dental Excellence Reflection Tool, a very useful structured document that helps shift from perfectionist thinking to excellence-focused practice. Perfectionism constantly seeks approval from others, while excellence comes from within, guided by your own professional judgment. Perfectionism avoids feedback, seeing it as criticism. Excellence embraces feedback and considers it to provide essential data for improvement. Perfectionism fears mistakes. Excellence learns from mistakes. Perhaps most importantly, perfectionism is exhausting, while excellence is energizing. One dentist I worked with was renowned for his technical skill, but considered leaving the profession due to burnout. He would not accept anything less than a 10 out of 10. When he shifted from perfectionism to excellence, his stress levels decreased, he stopped running late all the time, and he increased his income by 25%. His clinical outcomes didn't suffer, they improved. He could think clearly, make decisions confidently, and focus on what truly mattered for each patient. So what are the psychological mechanisms behind perfectionism? See, perfectionism isn't just a personality trait. It's a psychological response with specific triggers and patterns. At its core, perfectionism is built on fear. Fear of judgment from colleagues, fear of letting patients down, fear of not meeting self-imposed standards, fear of uncertainty. So here's how the cycle works. There's a trigger, your amygdala, your fear center, lights up, while your prefrontal cortex, responsible for rational decision-making, becomes less active. Your thinking becomes distorted, you catastrophize. If this crown isn't perfect, my reputation will be ruined. You also start to overgeneralize. I always mess up complex cases. And you start to engage in black and white thinking. Either this is perfect or it's a complete failure. These distortions drive perfectionist behaviors. Excessive checking, redoing adequate work, seeking reassurance, or avoiding challenging cases. The irony of this all is that for a few moments, these behaviors reduce anxiety. They reinforce the cycle as you feel a temporary calmness. What's insidious is how perfectionism is reinforced by dental training. In dental school, we're taught to spot the smallest imperfections, practice on typodont teeth in ideal conditions with unlimited time. Then we enter practice where conditions are rarely ideal. Time is limited and patients have unique challenges. Yet that perfectionist mindset stays. Understanding this mechanism helps us see that perfectionism isn't a virtue. It's a maladaptive response to fear. Well, the good news is that once you recognize this pattern, you can interrupt it with our CLEAR framework. The CLEAR framework is a practical, evidence-based approach to moving from perfectionism to excellence and contains 5 elements that are interlinked. All 5 need to be implemented to get the most out of the framework. The C stands for calibrated perspective. This is the foundation. Everything else builds on this mindset. Redefining success isn't about lowering your standards. It's about setting standards that make sense in real life. Start by redefining what success looks like. When you carry out clinical work with patients, instead of asking, "Was this perfect?" now you can ask yourself, "Did I provide the best care possible given the circumstances? Is this outcome clinically sound? Will this genuinely benefit my patient?" At the end of every day, take 1 minute to identify 3 things that went well. This retrains your brain to recognize excellence instead of fixating on what you previously would call imperfections. The L stands for limited standards. If you've ever found yourself stuck in overthinking, well, this one's for you. Overthinking feeds off vagueness. So give your mind something solid to work with. Create a good enough checklist for common procedures, defining what clinically excellent, not perfect, looks like. For a crown prep, this might include adequate reduction of the tooth, and you can still do a beautiful anatomical or a biologically oriented preparation technique crown prep. Clear margins, no undercuts, occlusal clearance verified. Once these requirements are met, the procedure is complete, full stop. The E stands for effective time boundaries. Here's where things get practical. Structure beats stress every time. Allocate a set time for procedures and stick to it. Let's say you have allocated 45 minutes for a crown prep, and time's up. Now is the time to ask yourself, is this clinically sound? If yes, move on. Define the end of your clinical day with a simple 3-minute close down ritual. Review notes, set up for tomorrow, and reflect on the day. Then stop. No catching up at 10 p.m. Your brain needs clear boundaries between work and rest. The A stands for allied support. This shift is often overlooked, but it's essential if you want to be emotionally resilient. Dentistry can be quite lonely, and it's easy to think you're the only one doubting yourself. One way of tackling this harmful belief is to go and find a colleague or two. Share some clinical thoughts, not for validation, but for perspective. Share your doubts, challenges, mistakes. You'll discover every dentist faces similar struggles, and the perfect dentist doesn't exist. And finally, R. Renewal beyond dentistry. Well, if you've made it here, this is the shift that keeps it all doable long term. It's easy to let your whole identity revolve around dentistry, and I've seen many colleagues who live the persona of a dentist. Like even when we meet outside the context of dentistry, they remain in that role of dentist. Protect time for something else, for activities outside dentistry, exercise, creative pursuits, family time, or simply rest. You're not being self-indulgent by taking time away from dentistry. You're investing in the sustainable excellence of your dental work and your well-being. If you found the CLEAR framework helpful, comment CLEAR practice below, and I'll send you our complete CLEAR implementation guide, a comprehensive overview with worksheets to help apply each element in your daily work routines. When you start with implementing the CLEAR framework, start small. Choose one element that resonates with you this week. Perhaps begin with calibrated perspective by identifying 3 clinical wins daily. Or you could try limited standards by creating a good enough checklist for common procedures like composite restorations or root canal treatments. The goal isn't eliminating high standards. It's about channeling them into sustainable excellence and moving them away from the draining perfectionism. So now we've covered what perfectionism really is, the difference between perfectionism and excellence, why you should move away from perfectionism and into excellence, and the CLEAR framework. Calibrated perspective, limited standards, effective time boundaries, allied support, and renewal beyond dentistry. This isn't about lowering standards, it's about making them human, sustainable, and beneficial for both you and your patients. Excellence isn't the absence of mistakes, it's your ability to learn from them. It's providing the best possible care within practical constraints. It's about finding joy in your work again. Don't forget to comment with clear framework for our perfectionism assessment tool, excellence over perfection for our dental excellence reflection tool, and clear practice for our complete clear implementation guide. Thank you for investing in your professional well-being. When dentists thrive, patients benefit too. I'd love to know what topics you'd find helpful in future videos. If you have a moment, do leave a comment below with any topics or challenges you'd like me to address in future videos. And remember, let it be human, let it be enough, let it be excellent. Thank you for watching.